Okay, thank you very much. All right, I think we're about ready to get started. And, okay. All right. In order to move things along a little bit more smoothly, we have a number of you that are attending that didn't respond to the original meeting request, which is great. We're happy to have you here, and thank you for participating. We're going to probably pass around a sign-in sheet so that we can have your contact information for future meetings if you did not, in fact, sign in or have the time to sign in at the front desk. So that'll be coming around shortly. For those of you that didn't receive a copy of the handout, it's the WNI code. Perhaps I don't know how many extra copies we have, but we have passed them out to a number of people. And if need be, if you'd like a copy, raise your hand, or you can share with a neighbor. So welcome. My name is Lori Weaver. I'm the Acting Chief of the Benefits Division for the Department of Healthcare Services. I've been here less than 6 months, so that's my disclaimer, and I'm hoping that the other participants that are with me here today are going to be able to help me with some of the historical information related to the physician visit limit statute and our communications with the Centers for Medicare and Medicaid. But I'd like to introduce, before we get going, Dr. Sherry Smalley, who's the Chief of the Medical Policy Branch in the Benefits Division, and also Cynthia Smiley, who works with my office very closely and is our contact liaison with the Centers for Medicare and Medicaid. So without further ado, I think we'll get started. Or perhaps not. So introductions of Department of Healthcare Services staff. We have a number of stakeholders here in the room today. The purpose of this meeting is to update you all with respect to our progress in implementing the physician visit limit legislation that was passed in 2010. 2010, thank you very much. And we'll give you an opportunity once we go through the slides to ask us questions. For those of you that are participating in the webinar, there is the opportunity for you to type in questions, and we are going to answer those as they come in at the end of the discussion. There are, for those of you that are here in the room, there are buttons on your table. If you would like to ask a question, you press the button. We want to make sure that the people that are participating in the webinar can hear you as well. So you press the button and speak. When you're finished, press the button again so that it opens the mic up for someone else that wants to ask a question at a later time. So the physician visit limit legislation, Welfare and Institutions Code Section 4131.07, as we mentioned, was passed in 2011, thank you very much. And it governs the physician visit limit. The statute was approved by the governor on March 24th of 2011 as part of the Assembly Bill 97. There were a number of components to that bill that you all may be familiar with that had to do with rate reductions and some other things, but this was also included in that bill. And it was the Assembly bill that passed through the Committee on the Budget for Healthcare Services. Essentially, the statute limits physician office and clinic visits to 7 visits per beneficiary per fiscal year. So that would be from July 1, of the beginning of the fiscal year, through June 30th of the next year. And these apply specifically to Medi-Cal beneficiaries. I think I skipped. So part of our requirements when we implement a new policy, new regulation in that affects the Medicaid plan, and in order for us to draw down federal financial participation from the federal government, we are required to communicate directly with the Centers for Medicare and Medicaid to get approval of to our state plan to include or exclude a certain service. So, yeah, I think, hold on, we're having a technical moment. So how do we get this fixed? Okay. Okay. So, pardon me, we're having a little technical difficulty. It looks like perhaps we have the wrong slides loaded. And so what we're going to do is try and talk our way through this until we can make a determination about getting the right slides. Essentially, we did submit our state plan amendment to the Centers for Medicare and Medicaid. That occurred in July 28th of 2011. And the state plan amendment that we put forward will amend the state plan to implement the Welfare and Institutions Code, a copy of which you have in front of you, or if you are participating via webinar, it will be posted on our website along with the correct slides within the next day or so. This section of the Welfare and Institution Code limits physician office visits, as I mentioned, to 7 visits per fiscal year per beneficiary. The visits are for services provided by a physician or a medical professional under the supervision of a physician. So, for example, a nurse practitioner, a physician's aide, that are covered benefits under the Medi-Cal program. When we submit a state plan amendment to the federal government, we have 90 days to go through a didactic approval process, and as a result of a number of the questions that were coming back and forth between the department and the Centers for Medicare and Medicaid, this particular state plan amendment was taken off the clock in May of 2012. Certainly. The state plan amendment that we originally submitted in 2011 was taken off the clock in May of 2012. We are continuing, however, to negotiate this particular state plan amendment with the Centers for Medicare and Medicaid, and we'll be submitting an amended SPA at a future date. So I want to talk a little bit about the policy itself. The physician services provided in the following locations. Yes, sir, go ahead.
When you say off the clock, that means that it's no longer, it's not valid right now, it has not been approved by CMS, or are we holding off on that? Is that what it means?
Yes, that's what this means. We do not have approval from CMS yet, and we don't implement until 60 days after we receive approval from the Centers for Medicare and Medicaid. When you say this will be presented again, are you referring to the SPA itself? Yes, it will be. Yes, it will be presented again. Go ahead.
I'm sorry, another clarifying question. So if the SPA was submitted in July of 2011, was there a time limit that it needed to be either denied or approved? And then if you're off the clock in May of 2012, I guess I was thinking that there was a 90-day life period before it either needed to be approved or denied. And if you're off the clock in May of 2012, it seems like that time has lapsed.
Between the original filing and May of 2012. Yeah. So I wasn't in this position at this time, and it appears Cynthia has stepped out. So I'm going to have her explain the back and forth that occurred between the Centers for Medicare and Medicaid and the department. But there were a number of communications and various reasons why it may have been taken off the clock at that time. So we'll have to get back to you on that. We'll have an answer for you. So I want to talk a little bit about the statute. Again, this is a repeat of a similar meeting that we had in September of 2011. we had requests from a variety of stakeholders that we update you with respect to where we are with this particular SPA. So I want to go over some things that you may have heard before, but they may be new to you. So I want to give you the opportunity to ask questions should you need to. So the physician visit policy applies to physician services or services provided under the supervision of a physician at the following locations. It would be hospital outpatient departments, not inpatient, hospital outpatient departments, physician offices, community clinics, federally qualified health centers, rural health clinics, or Indian Health Services clinics. There are statutory exemptions to the physician limit process. And I want to talk a little bit about the exemptions first. The exemptions apply to particular beneficiaries. So if you're a beneficiary of this type, the physician limit does not apply to you. Beneficiaries that are pregnant through 60 days postpartum, beneficiaries under the age of 21, beneficiaries receiving specialty mental health services, beneficiaries in long-term care facilities, beneficiaries enrolled in the PACE program, Program for All-Inclusive Care for the Elderly, or the Senior Action Network, the SCAN program, or beneficiaries enrolled in the AIDS Healthcare Foundation. Beneficiaries in Medi-Cal managed care are exempt. Beneficiaries enrolled in Medicare and Medi-Cal, the dual eligibles, are also exempt.
On the back on under F, the plan payments are reduced. So it doesn't apply to beneficiaries covered in the Medicare setting, but there was a reduction in the plan rate. So that actually confirms where is that exemption? See if that's another exemption.
I don't know about the plan rates. We can check on that to make that determination. I'm not quite sure whether either Dr. Smalley or Cynthia know whether that occurred, but a decision was made that the Medicare managed care population would be exempt. This applies exclusively to the fee-for-service population and not the managed care population.
So there is no exemption for the managed care by Medi-Cal. I don't see it, so it doesn't exist, right? That's a departmental, but is that a regulatory thing or is that just?
Well, it has to do with the plan management of the patient population and the fact that the plans do case management of the population and also monitor visits and things of that nature. So it was built into their rates, and I'm not quite sure if there was a deduction taken, and I'm going to refer to Medi-Cal Managed Care to respond to your specific question on that. Yes. Specialty mental health services, yes. Correct.
Right? I thought it was special mental health services was a specific program.
It is a specific program.
So that only applies to patients in that specific program.
Correct.
Patients who are receiving any mental health care, right?
Patients that are in the specialty mental health program. That's correct. There are different aid codes. And again, I need to remind you for the people that are participating via webinar, if you could use the buttons on your table to ask questions, it'd be real helpful to us. Or if you're in the back there, if you could come forward.
So it does not include any